Welcome again. I want to talk now and introduce you to Module 6, the last one. You've done extremely well getting there. So, Module 6, as I said in Module 5, is a culmination of synthesis of your theory that we talked about earlier, evidence-based practice, that thing called translational science, and all of that involving quality improvement. There's a whole bunch of this. If we look at our outcomes for Module 6, it talks about explaining the development and use of evidence in the form of clinical practice guidelines, CPGs for short. And so we're going to explain the development and use of evidence of clinical practice guidelines, and then synthesize processes of evidence-based practice, quality improvement to improve nursing quality in the advanced practice role, which is where you're going to be. So those are two things. And basically, I'd like to just introduce again what are clinical practice guidelines. Now, you've seen them before. I know that. Some of you probably actually use them in your practice as an RN. But the overview of this is that they are recommendations for clinicians about care of patients with specific conditions. They should be based on the best available research, evidence, and practice experience. And we're going to look at an overview. And what I'm going to do is review what the Institute of Medicine, how they define CPGs. And they are statements that include recommendations intended to optimize patient care that are informed by a systematic review of the evidence and an assessment of the benefits and harms of alternative care options. Huge mouthful there, but that statement speaks to a ton of things. Now, I'm going to address right up front. Some clinicians feel that CPGs, clinical practice guidelines, are sort of like cookbook medicine. They accused evidence-based practice of being just that. But what they really do is really based on a set of recommendations put together by panels of experts to help make sure that, let's say, someone who has diabetes or is going to get a diagnosis of, say, type 2 diabetes over in California, in the rural area there, will get the same kind of treatment as a patient diagnosed in an urban clinic of New York City. It's trying to make sure that our patient care is becoming more standardized in a way that benefits that patient with that particular diagnosis. Now, does it mean that you have to follow every level of that guideline? Some levels may work well for your patient in those rural mountains of California versus the patient that sits in an urban setting in New York, for example. You may have to tweak that. And that's what you should be doing. Because remember, all of this is centered on patient or family centered care. That's where the theory comes in. That's where evidence comes in. That's where QI comes in. So you're going to, in this module, actually do a proposal of a clinical practice guideline, tweaking it in ways that you feel it should be done. But it's going to be based, your clinical practice guideline is going to focus on an area of concern that you find very interesting, that you find very appropriate for an advanced practice nurse role. So let's say you have an interest in pediatrics. And you will see in this particular module, there is an example of development of a clinical practice guideline centered on pediatric population. And the article that you're going to read about gives you an idea of how that CPG was developed. What we're asking you to do here is to build a poster that actually takes you through steps of development of a CPG. Yours is going to be only a proposal because it does take a panel of experts to do this. But we wanted to give you a taste of what it was like to do this. And it also helps pull in everything you learned in this module. And instead of writing a paper about that, we thought you'd really enjoy building a poster instead. And this poster can actually be used in real life if you feel the need to do that, or if you have the need to do that. So that's what clinical practice guidelines are all about. So it's systematic. Users of this are clinicians, advanced practice nurses, It's certainly our RNs, but again, we want your folks to be more advanced in practice. So don't take something you did as an RN. I want you to take something that's going to require an advanced practice nurse to use. So I want you to put that spin on it. That's very important, that focus on it. You can pull up under many different views. I'm using UpToDate right now. I'm just using that as an example. I typed in, what is a clinical practice guideline? And you'll come up with a lot of things. NIH is a great one. The IOM, the Institute of Medicine, is excellent. Those, you want to make sure that you're delving into credible sources to review what a clinical practice guideline is all about and what the developers go through and their processes that they use to achieve a good, solid clinical practice guideline, especially for advanced practice. So please do that if you're not sure about what clinical practice is all about. Going back to our module now, now that we've reviewed what it's all about, let's look under your checklist. That's the next thing we'll do. Your first task is to read the article, and it's called CPG Fluid Resuscitation in Neonates and Pediatric Patients. Now, you may not care about that. However, it will give you some insight toward building that CPG. And we feel that this is a great article that will help you at least pull out the major concepts of what a CPG is all about. Now the big task. This is what we're asking you to do for Module 6. As I've said to you, it's time for you to download your template, which I have provided, of your proposal, your CPG proposal, and you're going to start to build that poster. I want you to follow all the guidelines that have been provided. Pay good attention to all directions. And this is going to help ensure your success with the project. You have built a major component of this using the synthesis of literature from your Module 5. So you can sort of download that and go, okay, what do I need to do to refine this particular piece? So we've also already helped you get started with this. What we hope is that you'll find that this is a very informative way, again, of pulling all the major concepts you've learned about theory, research, evidence, quality improvement, translational science to inform and guide your advanced nursing practice. Each component of this poster plays an important part toward the delivery of equitable, ethical nursing care for your future patients. And we know that all patients are affected in healthcare as it exists now and in the future. And you are part of that future. So we hope you have enjoyed this module. We hope you enjoyed the course, and we hope you found this really useful as you move forward in our program. Again, any questions you have, please address those directly to your faculty. And we wish you all the best.